Look at your tongue right now. If it has turned pale, fiery red, thick white, dark and furry, or pressed itself into ridges, that is not just age and not just coffee. In 15 years of clinical practice, I can tell you this. Your tongue often shows the hidden problem before the rest of the body starts naming it. What you're about to hear, nobody is going to tell you at your next appointment. The system profits when you stay sick, not when you get well. Subscribe and hit like, then listen carefully. A healthy tongue is usually pink, evenly moist, and covered in tiny bumps called papillae. That means the small textured projections that help with taste, friction, and food control. It sits in one of the busiest biological intersections in your body. Blood flow passes through it constantly. Immune cells patrol it constantly. Nerves report from it constantly. Surface cells renew on it constantly. That is why it becomes one of the earliest dashboard warning lights in the body. Most people are taught to treat the tongue like a toothbrush problem. Brush harder, scrape harder, ignore it. That is wrong. Some tongue changes are local, some are mechanical, some are infectious, but some are systemic. That means they reflect a process happening beyond the mouth in your blood, nutrition, airway, metabolism, or tissue repair systems. Let me explain how that dashboard works. Color tells you about circulation, oxygen delivery, inflammation, and overgrowth. Texture tells you whether papillae are growing, disappearing, or being coated. Shape tells you whether the tongue is swelling, being compressed, or being injured. A smooth tongue is not the same message as a coated tongue. A pale tongue is not the same message as a red tongue. A wandering patch is not the same message as a fixed patch. Different light, different system, different response. In medicine, inflammation of the tongue is called glossitis. That means the tissue has become irritated, swollen, and biologically active. Loss of papillae is sometimes called atrophic glossitis. That means the tongue surface has lost its normal texture and begins to look smooth, glossy, and raw. A yeast overgrowth is called candidiasis. That means candida has grown beyond its normal balance in the mouth. A persistent thick white patch that does not scrape away may be leukoplakia. That means an abnormal white plaque that needs professional evaluation because some cases progress toward cancer. A persistent red patch may be erythroplakia. That means a red area with a higher level of tissue concern than most people realize. These are not words to scare you. These are words to orient you. Now here is the critical principle. A tongue is not a diagnosis. It is a signal. One dashboard light by itself does not tell you the whole engine failure, but it tells you where to look. Ignore the light, and the system worsens in silence. Read the light, and you get a chance to act early. That is the advantage. Use it. The first warning light is a pale tongue. Not a naturally light pink tongue, a washed-out tongue, a drained-looking tongue. A tongue that seems to have lost its healthy color along with the energy in the face and the spark in the eyes. People often dismiss this because they are tired anyway. They say they have been under stress. They say they are getting older. They say they have been busy. But a pale tongue often belongs in a larger pattern of anemia. That means your blood is not carrying oxygen efficiently enough to meet demand. Here is what actually happens. Much of the tongue's color comes from blood flow and from hemoglobin. That means the iron-containing protein inside red blood cells that carries oxygen. When hemoglobin falls, or when red blood cell production falls, the rich pink color can flatten into a pale or almost chalky appearance. If iron stores are low, ferritin, that means your stored iron reserve, often falls first. Then the body begins rationing. Oxygen delivery becomes less resilient. Muscles tire faster. The brain becomes less sharp. The heart works harder. The tongue, because it is so vascular, often shows the change early. In clinical practice, I pay close attention when a pale tongue travels with fatigue, shortness of breath on exertion, dizziness, hair shedding, brittle nails, restless legs, or feeling cold all the time. That cluster matters. Heavy menstrual bleeding matters. Frequent blood donation matters. Stomach irritation from anti-inflammatory drugs matters. Reflux medications that reduce acid for long periods can matter. Hidden gastrointestinal blood loss matters. A dashboard warning light is useful only if you connect it to the rest of the panel. Now, not every pale tongue means severe disease, But it is not a decoration issue. It is not cosmetic. It is physiology. If your tongue looks paler than it used to, and your body feels slower than it used to, do not self-medicate blindly with random iron supplements. Too much iron is not harmless. You need the cause, not just the capsule. Talk to your doctor about whether you need a complete blood count, iron studies, ferritin, and in the right setting, vitamin B12 and folate testing. If you have black stools, chest pain, marked breathlessness, or severe weakness, do not wait for internet reassurance. Get evaluated. Read the light correctly. Act on it. The second warning light is a tongue that turns bright red, glossy, and smooth, as if the surface has been polished. People describe burning. They describe tenderness. They describe food suddenly feeling too spicy, too acidic, too sharp. This is one of the most under-recognized nutritional warning lights in medicine. In medicine, this pattern is often glossitis. That means inflammation of the tongue. And more specifically, atrophic glossitis. That means the papillae have flattened or disappeared, so the surface loses its normal velvety texture. Why does that happen? Because the tongue is a rapidly renewing tissue. It depends on protein turnover, vitamin sufficiency, good blood supply, and healthy mucosal repair. When vitamin B12 is low, folate is low, iron is low, or the mucosa is chronically irritated, the tissue cannot maintain its architecture. The dashboard light changes from textured pink to smooth red. Vitamin B12 deficiency deserves special respect. B12 helps build healthy red blood cells and supports myelin. That means the protective insulation around nerves. That is why a smooth red tongue can travel with numbness, tingling, poor balance, memory fog, and fatigue. Folate deficiency can produce a similar red inflamed look because folate is central to cell division. Iron deficiency can do it too. The tongue does not care which lab report is causing the repair failure. It simply shows you that the surface is losing its normal structure. This is where people make a major mistake. They focus only on the mouth. Mouthwash, gel, scraper. Avoid tomatoes. Those measures may reduce irritation, but they do not solve the reason the tissue changed. If the dashboard light came on because absorption is impaired, because diet is inadequate, because long-term stomach acid suppression changed nutrient handling, because celiac disease is interfering with absorption, or because chronic illness is draining reserves, then the mouth is the messenger, not the origin. How to fix it? First, stop trivializing it. Second, if the tongue is newly red, smooth, burning, or painful, especially if you also have fatigue or numbness, ask for real evaluation. B12, folate, iron, a medication review, a look at digestion and absorption. If you wear dentures, if you smoke, if you use irritating dental products, address those too. If swelling is severe or breathing becomes difficult, treat that as urgent. And while the workup is happening, reduce direct irritation. Avoid smoking. Reduce alcohol. Go easy on acidic and very spicy foods. Support the tissue while you identify the cause. Do not silence the warning light. Decode it. The third warning light is white. This is where many people get confused because not all white tongues mean the same thing. A light morning coating that improves with hydration and gentle cleaning is one thing. A thick, creamy patch. A cottage cheese-like layer. White areas that leave soreness or slight bleeding when rubbed. That is a different message. So are white patches that do not scrape away at all. Let me explain the important split. Oral thrush is also called oral candidiasis. That means an overgrowth of candida yeast in the mouth. This usually creates creamy white patches, often on the tongue and inner cheeks, sometimes with redness, soreness, cracking at the corners of the mouth, or pain with swallowing. Why does it happen? Because the microbial balance changes, immune defenses drop, saliva dries up, blood sugar rises, antibiotics clear out competing organisms, inhaled corticosteroids leave residue, dentures trap moisture and organisms against tissue. The dashboard warning light turns white because a fungus that normally lives quietly in the mouth now has an opportunity. Here is the part nobody tells you. Thrush in a healthy adult without an obvious trigger is worth respecting. It does not automatically mean something catastrophic, but it does mean you should ask why the balance changed. Diabetes matters. Dry mouth matters. Steroid inhalers matter. Cancer treatment matters. Denture care matters. Immune suppression matters. If it shows up suddenly in an adult and keeps returning, the tongue is not being dramatic. It is reporting a shift in the internal environment. Now here is the second white pattern. A thick white patch that does not rub off may be leukoplakia. That means an abnormal white plaque caused by chronic irritation or tissue change. Sometimes it is benign. Sometimes it is precancerous. That is why guessing is not medicine. A white patch that is fixed, persistent, thickened, or paired with tobacco use, alcohol exposure, or mouth pain needs professional eyes on it. How to fix the white warning light depends on which white light you have. If it is thrush, treatment may involve antifungal therapy and correction of the underlying setup. Rinse after steroid inhalers. Clean dentures correctly. Control blood sugar. Address dry mouth. If it is a patch that does not scrape away or lasts beyond 2 weeks, talk to your doctor or dentist. Do not wait for it to declare itself. White is not always harmless. Read the shape, not just the color. Get it checked. Now, before we go further, understand this. Your tongue is not an isolated strip of muscle inside a mouth. It is connected to your blood, your airway, your immune system, your nutrient status, and your tissue repair machinery. That is why one person's tongue problem is local irritation, and another person's is a deeper systemic clue. Same organ, different warning light. Stay with me. The fourth warning light is the one that frightens people the most because it looks dramatic. The tongue turns yellow, brown, greenish, or black. It looks furry. It looks dirty. It may taste metallic. It may trigger bad breath. People immediately think infection, poison, or cancer. Most of the time, that is not what is happening. In medicine, this is often called black hairy tongue. The important mechanism is not hair growth, it is failed shedding. The technical word is desquamation. That means the normal shedding of surface cells. On the top of the tongue are filiform papillae. That means the tiny thread-like projections that create texture. When these papillae stop shedding properly, they lengthen. Once they lengthen, they trap debris. Tobacco stains them. Coffee stains them. Tea stains them. Bacteria and yeast can accumulate on them. Dead cells collect on them. The dashboard warning light turns dark and rough. Why does the shedding fail? Poor tongue cleaning can do it. Dry mouth can do it. Antibiotics can shift the microbial environment and contribute. A very soft diet can do it because the tongue loses the regular friction that helps clear surface buildup. Mouthwashes with oxidizing agents can irritate the tissue. Smoking can drive it. Heavy coffee use can exaggerate the color. Older adults and people with chronic dry mouth see it more often because the oral environment becomes less self-cleaning. What research actually shows is reassuring here. Black hairy tongue is usually benign. That means it looks alarming but typically does not represent a dangerous disease by itself. But benign does not mean meaningless. It still tells you something about the oral environment. It tells you that dryness, friction loss, microbial imbalance, hygiene, or irritants have shifted the surface biology enough to change how the papillae behave. That is still a message. It still deserves correction. How to fix it? Restore the environment. Hydrate. Gently brush or scrape the tongue. Improve oral hygiene without attacking the tissue. Reduce tobacco. Review irritating mouthwashes. If your diet is all soft foods, add more texture when medically appropriate. If an antibiotic course preceded the change, note the timing. If the discoloration persists despite better care, get a dental or medical evaluation so the wrong light is not being mistaken for the right one. Do not panic. Do not ignore. Clear the buildup and correct the setup. The fifth warning light is not color, it is shape. A scalloped tongue has ridges or tooth marks along the sides, as if the tongue has been pressed against the teeth long enough to leave an imprint. Many people think this is just how their tongue has always looked. Sometimes it is harmless. Sometimes it is one of the most overlooked airway and swelling clues in the body. Here is what actually happens. The tongue becomes relatively enlarged, swollen, or compressed. Macroglossia, that means an unusually enlarged tongue, is one explanation in some cases. Edema, that means fluid-related swelling, is another. More commonly, the tongue is not dramatically oversized. It is simply spending hours pressing laterally against the teeth because of clenching, mouth breathing, low tongue posture, or reduced airway space during sleep. Pressure leaves a pattern. The dashboard warning light becomes ridged. Now pay attention to this. A scalloped tongue often travels with bruxism. That means grinding or clenching the jaw. And with obstructive sleep apnea, that means repeated collapse of the upper airway during sleep. That matters. If you snore, wake unrefreshed, get morning headaches, feel exhausted in the afternoon, or are told you stop breathing at night, the tongue may be showing you the airway story before a sleep study ever gets ordered. Night after night, the mouth opens, the tissues dry, the tongue posture changes, the airway narrows, the muscular pattern shifts, and the edges of the tongue take the imprint. That is not random. There are other causes too. Dehydration can make the tongue drier and more likely to swell or press outward. Thyroid dysfunction can contribute to tissue changes. Inflammatory conditions matter. Dentition and jaw structure matter. Rarely, infiltrative diseases such as amyloidosis, that means abnormal protein deposits in tissues, can enlarge the tongue. Rare does not mean impossible. It means do not diagnose yourself from one mirror. How to fix it? Connect the mouth to the sleep and breathing history. That is the move. If you have a scalloped tongue plus snoring, dry mouth on waking, daytime sleepiness, high blood pressure, or witnessed breathing pauses, talk to your doctor about sleep apnea assessment. If you clench, talk to your dentist about the wear patterns on your teeth and the pressure patterns in your jaw. Improve nasal breathing. Hydrate. Review medications that dry the mouth. Respect the ridges. They are pressure marks. Pressure marks mean something. Follow them. How old are you? Write it in the comments. I want to see how these tongue patterns shift across age groups because after 40 the mix often changes. More dry mouth from medications. More B12 absorption problems. More snoring and sleep apnea. More denture friction. And a higher risk that a persistent patch is not something to brush off. Write your age in the comments so I can focus future videos where you actually are. The sixth warning light is the one I want you to take most seriously. A fixed red patch. A fixed white patch. A sore that does not heal. A thickened area. A lump. Numbness. Pain with swallowing. Trouble moving the tongue. Bleeding without a clear reason. This is where delay becomes dangerous. Now, not every patch is cancer. That matters. Geographic tongue. That means a benign pattern of smooth red patches with pale borders that can move around over time is usually non-cancerous. It migrates. It changes location. It often flares with spicy or acidic foods. That is one kind of light. A fixed lesion is different. A patch that stays in one place and does not resolve is a different dashboard warning light entirely. In medicine, a persistent white lesion may be leukoplakia. A persistent red lesion may be erythroplakia. Tissue that begins changing abnormally at the cellular level is called dysplasia. That means precancerous disordered growth. The most common oral cancer type is squamous cell carcinoma. That means a cancer arising from the flat cells lining the mouth and tongue. The tongue can develop these lesions on the top, sides, underside, or base. People wait because it does not seem dramatic enough. They wait because it is not severe pain. They wait because they think cancer should look more obvious. That delay is costly. Risk matters here. Tobacco matters. Alcohol matters. HPV-related disease matters, especially in the back of the mouth and throat. Age matters. Poor nutrition can contribute to vulnerability. Persistent irritation matters. But do not make the mistake of thinking no risk factor means no risk. The rule is simpler than that. If a mouth lesion lasts more than 2 weeks, especially if it is fixed, thick, red, white, bleeding, numb, painful, or paired with trouble chewing, swallowing, speaking, or moving the tongue, talk to your doctor or dentist promptly. Get it examined. If needed, get it biopsied. That is not overreaction. That is early action. This is the fear peak for a reason. Because most people respond too late to this light. Do not be most people. Use the 2-week rule. Fixed patch, persistent ulcer, new lump, trouble swallowing, numb tongue, voice change. Act. Do not negotiate with that warning light. Here is the action protocol. Step 1. Check your tongue in natural light for 7 mornings in a row before coffee and before vigorous brushing. Take a photo each day. The dashboard warning lights are easier to read when you stop relying on memory. Step 2. Separate coating from tissue. If a light surface film improves with hydration and gentle cleaning, that is different from a fixed patch, a smooth red area, a deep sore, or a lump. Know what wipes away and what does not. Step 3. Audit the setup. Write down dry mouth, smoking, alcohol, dentures, inhalers, recent antibiotics, reflux medication, diabetes, snoring, and mouth breathing. These are not side notes. They are often the cause of the warning light. Step 4. Look for body clues outside the mouth. Fatigue, tingling, dizziness, breathlessness, swallowing pain, fever, weight loss, morning headaches, and daytime sleepiness change the meaning of the tongue finding. Connect the systems. Step 5. Correct the easy drivers immediately. Improve oral hygiene. Brush the tongue gently. Rinse after steroid inhalers. Clean dentures properly. Hydrate. Reduce tobacco and excess alcohol. Cut the irritants. Calm the tissue. Step 6. If the tongue is pale, smooth red, repeatedly white, or scalloped, ask for targeted evaluation instead of random supplements and guesswork. Blood counts. Iron studies. B12. Folate. Sleep apnea assessment when the history fits. Use medicine precisely. Step 7. Use the 2-week rule without exception for fixed red or white patches, persistent ulcers, unexplained bleeding, numbness, or lumps. Talk to your doctor or dentist. There is no prize for waiting. Move. Your tongue is not your enemy. It is a messenger. It is one of the clearest dashboard warning lights your body gives you because it sits at the intersection of circulation, immunity, nutrition, breathing, and tissue repair. When it changes color or shape, it is not betraying you. It is reporting. Pale may be telling you blood is struggling. Smooth red may be telling you repair is failing. White may be telling you balance has shifted. Scalloped may be telling you the airway story. A fixed patch may be telling you not to delay. Read the signal, respect the signal, respond to the signal. This is why prevention gets ignored. There is no billing code for standing in front of a mirror for 2 minutes and catching a problem early. There is no billing code for noticing a tongue change before the lab panel, before the sleep study, before the biopsy, before the crisis. The system profits when you stay sick, not when you get well. That is why basic body literacy is power. Subscribe and hit like. Help this channel grow so more people learn how to read the warning lights before their body has to start shouting.